All right. All right. Thank you very much. We've been battling with the network.
I sincerely apologize because I'm not even sure if the problem was from my end.
Sorry for that, please. I've tried battling with the network.
I sincerely apologize to everyone, really. So let's just, some people had questions before, but I really can't remember because it was in the comment section. And since we had to restart, the questions are no longer there. So I'm hoping that they can resend the questions.
Questions again.
Yeah, but till they resend the questions, we'll just continue answering the ones we have here. So are there any herbal products that can cure cancer?
That's a very good question. Most of the herbal products, or most of the products we see around, they are supplements. They can't really cure cancers generally. They are supplements. For example, if a person living with blood cancers generally, can never really cure the cancer. It cannot cure the cancers. There are only supplements that will help the patient in developing the immunity or in most of the herbal products you have cannot cure cancers.
Okay. So Karen asks a question. She says, what is the difference between malignant and benign?
Very good. There are two types of cancers generally, histologically. There is a benign form of cancer and there is a malignant form of cancer. The benign forms of cancer are the ones that will stay there. Let me use the word stay there. They won't move to another part of the body. They will just be there, like a lump or like a lipoma. You see some people with small swelling on their laps, or on their hips, or on their shoulders. It will just be there. It will not leave. But over time, it might now increase in size, now giving the pressure symptoms, compressing on the adjacent structures in that region. But it doesn't move away from there. But the malignant form of cancer is the one that metastasizes. For example, a woman with breast cancer, in a few weeks' time, can come with jaundice. That is the breast cancer has moved from the breast to the liver. A woman with breast cancer can become quadriplegic. That means that the breast cancer has moved from the breast to the spine to compress on the spinal cord. A woman with breast cancer, for example, the breast cancer can move from the breast to the head and give her features of raised intracranial pressure. That means that malignant cancer are the ones that move from one part of the body to another. The malignant cancer are the ones we usually refer to as the cancerous form. But the benign forms are just like lump and other things. But however, sometimes the benign form of cancer can be transformed into malignant form, depending on the type of cancer it is. So that's basically the difference between the benign form of cancer.
Okay, Karen.
The malignant form can leave the area of origin and move to another part of the body.
Okay. Karen, I hope he was able to answer your question. If you still need clarity, because we're running out of time, you can send an email to or a DM to our Instagram handle and can forward it to the doctor to get a more comprehensive explanation if that's not enough for you. Bolutiwe asks, how likely is it that a breast lump becomes cancerous?
Very good. If a patient comes with breast lump, we look at a lot of factors. For example, if a young lady of 21 years comes with a breast lump, okay, I might think this could be fibroadenoma. In such a patient, we'll do some investigations for that patient. For example, we do ultrasound scan for the patient, and over time, if you notice that the breast lump is increasing, you might do an excisional biopsy. That means that you do surgery for the patient, you take the lump and you take it for histology. So if it is cancerous, we follow you up. You commence other treatments like chemotherapy or radiotherapy. But usually, breast lump, when you say lump, usually fibroadenoma, those ones are benign. they don't usually transform into malignancy. However, they can still in some very few percentages. But in young ladies, most young ladies that come with lump, when you do surgery for them, most of them are usually fibroadenoma, and that is a benign form of cancer. But as the person advances, though we can these days we are seeing a lot of advanced form of cancer. You do other investigations and you suspect that this cancer is malignancy. Such patients, the modality of treatment is different.
Okay, thank you very much, Dr. Inde. I hope that answered your question. So, Amy has a question. He says, it's more like facts than a question. He says, according to NMA, Nigeria has only 4 cancer treatment centers as at April 2019. That's over a year ago. Who says that we need at least 170 treatment centers for our population of 170 million people? So as a nation, how have we been able to handle this? How have we been able to manage this? Have they built more cancer treatment centers, or are we still lacking in cancer treatment centers? Because for a population like Nigeria's own, and with the increasing rate of cancer and with how people are dying, what exactly is the country doing about it? Have they built more centers, or what exactly?
That's a political question. And that's a very good question. She's correct. Nigeria has very few cancer centers. In fact, Nigeria still have very few, even registry cancer centers. Registry cancer centers, they are part of the countries where we register the number of cancers, we take samples, we take data of the rate and mortality of cancer rate in Nigeria. Nigeria still have very low registry centers and very low cancer centers. And that, I think government should do a lot to increase the number of cancer centers we have in Nigeria, since those 4 cannot really, though we have a lot of private centers too that complementary that effort, but we still need a lot of cancer centers in Nigeria. A lot. That's why you see people traveling abroad. Even the few ones we have, how equipped are they? Or how is the government funding them? I think that's a long way for the government. I think the government should do a lot of things in funding those centers and even proliferating those centers, building more centers for cancers in Nigeria. I think it's a very good question, and I'm sure people will be.
That's more of a political question for the government.
Exactly.
Okay, so Karen says viruses like HIV and HPV are huge causes of cancer. Is there any current research to support the relationship between coronavirus and cancer?
That's a good question. That are implicated in causing cancers, as she said earlier, HIV, hepatitis, Epstein-Barr virus, etc. They are all implicated in causing cancers. But coronavirus is not part of the viruses that is implicated. I said that people with coronaviruses or people with cancers, they are also at risk of developing the devastating effects of coronaviruses. So people with cancers generally, usually prevent them, usually do a lot to prevent them, you shield them from having coronaviruses as much as you can. Because when a patient has cancer and is on chemotherapy, their immunity is suppressed in most cases. And once such a patient is exposed to coronavirus, the effect is so much. So such patients, we prevent them a lot from having coronavirus. But presently, as of today, coronavirus has not been implicated in causing any cancer presently.
Okay, so I hope that answered the question, Karen. He says that although other viruses have been proven to be related to cancer, that there's no research yet that proves that coronavirus has any relationship yet. Until now, for now, but in the future it might change, so we don't know about that.
For now.
So Leo asks a question. He says, my grandmom had breast cancer. My mom has breast cancer, am I likely to have any form of cancer, even though I am a man? Did you get that?
Come again. Can you
Dr. Ayinde, did you get that?
come again, please?
Okay,
Come
I
again.
apologize for the network issue.
Okay.
Okay. Leo says, my grandma has breast cancer. She had, rather. Sorry. My mom has breast cancer. Am I likely to have any form of cancer, even though I am a male child?
That's a good question too. If you have men, very few percentage of men have breast cancers. Less than 3% of men have breast cancer. So for a patient, for somebody genes from parents, BRCA2.
There's been network issues and we're running out of time. I really apologize, everybody. Let me see how many more questions we have left. Oh, Dr. Ayinde has. Dr. Ayinde has left again. I read an article made that the we apologize for the he and she. I think because of the question, he assumed that you were a she. Dr. Ayinde has actually left again, and we are running out of time. So we really apologize, but I'll just say that if any one of you still has questions that have not yet been answered, you can send an email to us. Okay, I can put up the email address here in the comment section, or you can send, easier for you, you can send a direct message to our Instagram DM so that we can attend to your questions and drop your mail as well, or we could reply to you directly through the DM, because I'm not a doctor. I don't want to try to answer questions that I don't really know much about, so that I will not be stating wrong facts. So we'll take up your questions for Dr. Ayinde and we'll send them directly to you. If you feel that you have questions that need to be answered, you can also reach out to us. And for anyone here who is interested in volunteering with us or funding or sponsorship, you could also reach out to us via Instagram DM. We are open 247 basically to talk to you. So just say thank you for taking our time today to join us, and I hope even with the network issues, you learned one or two things. We sincerely apologize for the issues. I mean, with the whole corona and staying indoors, there's not really much we can do but rely on the internet connection, and it's Nigeria. They failed us many times. So we'll also let you know if there's going to be a repeat session for this, because we have so many questions that were left unanswered because of the network issues and the lapses that we faced. So definitely we'll be coming back to answer these questions either via mail or through another Instagram live session, or it could be on any other of our platforms. But definitely we will keep you posted on that. Thank you very much for coming today, and have a good day. Enjoy the rest of your day.